Hello everyone. My topic is improvement of mental health of marginalized people in Australia. Background of the problem. People experiencing mental ill health often experience stigma and discrimination. Discrimination interferes with relationships and connects to family, friends, workplace, community, and culture, and negatively impact on recovery process for people experiencing poor mental health. Who are marginalized? Aboriginal and Torres Strait Islanders, women, children, refugees, LGBT communities, prisoners, drug abusers, migrant workers, aged people, people with disabilities, people living in remote areas of Australia. Current situation: 3 out of 4 people with a mental illness report that they have experienced stigma, with particular vulnerable groups facing higher risk. Almost 3.4 million Australians have both mental illness and substance use problem. People with comorbid problems are often discriminated, judged, and marginalized from service and the community. 1 in every 5 Australians experience mental illness in a year, and about 1 in every 2 person experience mental illness in lifetime. Same-sex attraction, gender dysphoria, and intersex conditions make people more vulnerable to discrimination, and this leads to a higher prevalence of mental ill health for these people. In 2012, 707 Australians suicided who had mental illness history. Mental illness is economic and social burden as well. 2.7 million work days are lost in each year because of mental illness of workers. New South Wales health budget contributes 54% as cost for indoor patients care for mental illness. Gaps and barriers in the policies. Research confirms that it is almost impossible to separate the existence of a mental health condition from the experience of a racial discrimination and mental health stigmatization, in particularly faced by Aboriginal and Torres Strait Islanders people with poor mental health, and needs to acknowledge their lived experience of racial discrimination. Women, aged people, and disabled people are impacted by mental illness or refugee status are among society's most vulnerable and disenfranchised groups. Such persons can experience significant social exclusion, marginalization, stigma associated with reduced health seeking, deprivation of dignity and human rights, and threats to health, well-being, and quality of life. A study based on experience of indoor patients taking treatment in Australian hospitals shows that health professionals are non-cooperative and do not discuss treatment plan with the patient or the relatives. The role of health practitioners: closing the gap. The understanding and ensuring of conduct of health professionals is particularly important as the lived experience of people with mental illness is directly affected by the skill, attitude, and behavior of the health professionals with whom they are interacted. Closing the gap. Evidence suggests that the broad, longer term anti discrimination and anti stigma initiative have more success rate in reducing the experience of discrimination by people living with poor mental health. Recommendations: new health policies should uncover new meaning regarding embodied stigma, identifying how marginalized people construct, experience, and negotiate stigma, and opportunities available to challenge stigma. Government requires to investigate traditional stigma models and explore dynamic interactions of multiple marginalized social identities by looking at commonalities and differences in embodied experience across and within the groups. Health policymakers should investigate and values and cultural norms of people with mental illness. Collaborative and innovative knowledge and diverse approach from stakeholders and promote community well-being. A research-based approach should be taken for analyzing of shared experience and provide a strategy to comprehend the complex lived experience of marginalized people to focus on closing the gap of for accessing primary health care. According to WHO, mental health conditions depends on increased vulnerability and reduced development, as these two factors are vice versa for healthy mental growth, and policymakers should focus on them as well. Conclusion: a key element for reducing institutional and individual discrimination is to strengthen community understanding and help people to identify and understand the early signs of mental distress. To improve mental health status of the marginalized people, stakeholders and government should focus on social, cultural, and economic values as well as housing, education, employment, healthcare, family support, and justice and social security. These factors can ensure strong, supportive communities and make people confident and capable of healthy mental status. Thank you for hearing.